The survivorship program is something that we've established to help patients kind of put the past and present and future together for their cancer care, give them a summary of where they've been, what type of treatments they've had. It's also to give them the, a discussion on present symptoms and side effects. What has been persistent after chemotherapy? Do they have ongoing concerns that maybe need some follow-up or need to be sent to a specialty office to get managed? And then looking at the future, where can we go from here? I'm done with my cancer care, but how can I decrease my risk that it'll come back? Because we did feel that patients, maybe weren't bringing up some of the side effects that they were having, whether they were nervous about it or maybe didn't feel like it was really important, and maybe it was a small problem that they didn't think they need to actually bring to their oncologist, but it was something that we do have treatments for, and it would be something that should be addressed. We have the patients come back after they've completed curative intent treatment. So for example, a patient may have had breast cancer, it was removed, and then we gave them some chemotherapy or radiation to decrease that risk of cancer coming back. So once they're done, we bring them to the office and we develop a care plan for them. And it's usually about 4 or 5 pages. It goes over in depth what their history is. When did they have surgery? Who was their surgeon? Did they have lymph nodes removed? What chemotherapy did they get? Did they go to radiation therapy? How many treatments did they get? Because a lot of patients don't even realize what they went through. When you're in the thick of chemotherapy and treatment, you just want to get it over with. You come every week, or you put in the time, but you don't even really know, what was that drug I got? We go over the side effects that they might still have that they don't even realize. Everybody who's been through this maybe has those side effects, whether it's swelling of their arm because they had lymphedema, lymph nodes removed from their armpit or wherever it may be. And then we talk about future, what do I do now? How do I decrease my risk of cancer coming back? We want to make sure you're not smoking, alcohol in moderation. We want to make sure that you're having a healthy diet and exercise. There's been actual studies that prove that exercise and maintaining a healthy BMI decrease the risk of cancer coming back. So I just think that patients really need to have a handle on their health care, and it's their care, and you really need to be educated. And so if anything, the survivorship program really helps to make sure patients are educated on where they've come and how to handle symptoms, and then what they can do for themselves to decrease their risk of cancer coming back.